hello there. It's Jeremy, your friendly neighborhood physical therapist again. Today we're going to be talking about postural taping. This is a technique I like to use with patients who, one, have poor posture, but have neck pain related to poor posture or shoulder pain related to poor posture as well. So again, similar to my other video, I like to use this cover roll tape to start out with. And then secondly, we're going to be using our anchor tape, our rigid strapping tape. So it's different than the other tape that we use. What's it called again?
Rock tape?
Rock tape, yes.
KT tape?
KT tape, that was the word I was looking for. Yes, different than that. We want it to be rigid and hold more so than stretch. So, what you're going to do first, you're going to kind of eyeball measure. But for females, we like to have them undress a little bit, give them a gown. Make sure they put the gown on the right way, not the wrong way. And then we're going to measure out about where we want to go. So we want to grab the front of the shoulder with the tape. And then we want to anchor it down kind of by, I would say around T8 to T12, around that area you should be fine. So we go one side, other side should be similar, and then we kind of measure that out. That's about where I want it. We're going to cut one piece and then a second piece just like that. And Amity's our camera worker today, so very good job directing, Amity.
Thanks.
Alright. Got our two pieces here, equal-ish length. Again, not have to be perfect. Then you're going to pull off the first layer, which can be tricky sometimes. And then what we do is we ask our patient to hold on to the front of the gown, so we still have access to the front of the shoulder, but we're not exposing her too much. So again, we're grabbing the front of the shoulder right here, and she's just relaxed in her normal posture. And we're going to anchor it down, just like that. So not a big pull or anything, this is just our base layer. So now that that's done, she can go here. And then we're going to do the same thing on the other side. Meanwhile, everyone's analyzing my poor posture while I do this. Okay, we're just going to hold on to that. Again, we're grabbing the front of the shoulder and kind of coming down right there. Kind of makes that cross pattern right there. So now she can leave that there. We're going to go with our brown anchor tape now. Again, you need tough fingers for this. So we kind of just eyeball where we want it at first, like so. And tear off the piece. Alright, now we're grabbing the front of the shoulder right here. Then I'm going to tell Whitney, perfect posture, I want your shoulders back, just like that. And kind of pull right there. Ta-da. So that piece I haven't pulled super tight because one, she's already given herself good posture. So I do one on that side, I rub it down, and then we go over here. We're going to do this side now. Eyeball it there. Grabbing the front of the shoulder again, right here. In perfect posture, Whitney's got her shoulders back. So I usually, again, do two pieces on each side. The first one I pull a decent amount, but the second one I pull a little tighter. And the first time I use this with patients, I don't go super aggressive, but getting their feedback the second visit is helpful to say, oh, you know what, I think I could be pulled a little tighter, or it was too tight, and you can kind of go from there. You can also change your angle of pull as well. I don't change that up too much. Alright, she's still got a good posture, and pull a tiny bit tighter. And we get more of the wrinkling and the brown tape through here, which is fine. It shows that we pulled this second piece a little tighter than the first. Good. Go back to this other side. Do one more on there. Whitney's got her shoulders back. There. Pin it down and make sure it's nice and tight on there. So again, there's a few things you can play with. You can grab more of the front of the shoulder. You can change the angle. You can change the amount of pull that you have. Again, patients can shower with this. It'll be wet, but they can leave it on for about 2 to 3 days is how long it can last. If they have any irritation, tell them to take it off. But it works really well to help posture. I had a patient this last week who said she had no headache pain after doing this taping method, and so it's quite effective. But again, similar to the other taping, it's more of a short-term fix, and you can educate your patients and say, long-term, we want you to have enough strength to be up here the whole time throughout your day. So if you have any questions, let me know.